Hi, this video is going to demonstrate the MaxxAir ETS Expandable Turning Surface Bariatric Air Mattress. The mattress itself is a 10-inch deep mattress. The middle section has 8 inches of air over 2 inches of foam. The side bolsters, when the mattress is expanded to the 48 inches to allow for that turning platform for your bariatric patient, the bolsters are 6 inches each on the left and right side, and they're 10 inches deep. That allows for kind of a firmer perimeter, also to keep your patient centered or your resident centered in the middle of the bed. It is a mattress replacement system that can go on any open architecture frame. Typically it's delivered on the Citadel Plus frame as a rental, but this is also a product that can be purchased as a capital item that you can have if you have a high bariatric population. It's designed to prevent and treat pressure injuries, as well as to provide a wider turning surface for that patient up to 1,000 pounds. Like we said, it's used for patients, bariatric patients who may be difficult to turn, because it does have a turn assist feature that will help turn that patient up to 30 degrees. Now, once again, it is a turn assist. It's not designed for you to push the button, turn assist to the right side, let's say, and run out of the room and document your patient is turned to the right side. It is to help you get that patient over with the momentum of the mattress. You would then use a wedge, a pillow, or a turning system and get that patient to their side and put the bed back into static or flat position. Because if you leave it hyperinflated, then you've got a firmer surface and the patient's backside has never left the bed. You also want to use that opportunity to inspect the skin. Skin should be inspected with each turn to make sure that you're on a good turning schedule for that particular patient, because turning should be specified to the patient and the patient condition. Typically, your standard hospital bed will hold up to 500 or 550 pounds, but when a patient gets to about 350, 380, typically you need a wider turning surface. And so even though your bed may hold 500 pounds, be conscious of the fact that you want to make sure you can adequately turn that patient and offload that tissue. So you may need to move to a bariatric surface. The weight limit is 1,000 pounds though, and it will expand to 48 inches. The contraindications are an unstable cervical, thoracic, or lumbar fracture, cervical or skeletal traction, or a patient who weighs greater than 1,000 pounds. We also want to make sure that you're inspecting the skin regularly and that you're making sure that those side rails are engaged prior to starting any turn feature. This is not an integrated surface. As we said, it's a mattress replacement that can be set on many different frames, so make sure that your side rails are totally engaged before starting a continuous lateral rotation or a turn assist. Okay, when the MaxxAir ETS is delivered as a rental product, it will be delivered on the Citadel Plus frame. We'll discuss the frame expansion at the end of this video. However, right now we do want to focus on the MaxxAir ETS. Like we said, the ETS stands for Expandable Turning Surface, and this will come in a 36-inch width, so you can get in and out your doors, in and out your elevators. But it has the capability to expand to 42 or 48 inches. Typically, we do want to expand it to the 48 inches. That way your patient remains centered in the bed. As we talked about, those bolsters are 6 inches of air, and so if you have both bolsters, it also creates a firmer perimeter for that patient to rest their arms on. When the pump is first delivered, you need to turn on the pump, and the on-off switch is on the side. Once the switch is turned on, then you need to power on the air button. Once the air is powered on, it's a press and hold. Once the air is powered on, the bed will then inflate, or the mattress will then inflate. It will inflate up to 10 inches. There are arrows in the front of the mattress that allow you to adjust the air. There's no special formula for what those lines represent. What we want to do is, once that surface is inflated, that when you're looking at the patient from a side view, that the patient is about 2/3 immersed up to nipple line into the surface, keeping in mind that their belly may be larger. They may have a larger pannus that's extending, but you want about 2/3 of the patient sunk into that mattress to get maximum immersion and envelopment. Now, once that mattress is turned on, there is an Instaflate button that you can push that will actually inflate the mattress faster. It is a blower, so it takes about 4 to 5 minutes to totally inflate that mattress. You never want to leave that mattress in the hyperinflated position. You only want to have it an Instaflate for lateral transfers or filling it up or boosting your patient, because it creates too firm of a surface for that patient. Even the patient that's 1,000 pounds does not need to have that max inflated air. Remember, you want that immersion and envelopment. Now, as you look at the surface, you may think, well, that patient is going to be infringing on the side rails. Keep in mind that you're talking about a patient whose girth is wider than your typical bed. So even though most of your beds are going to, your standard hospital beds will hold up to 500 pounds, a lot of times we're moving that patient that's 300, 350, 380 pounds to the bariatric bed, because we need that wider surface to make sure we're adequately turning that patient to offload them. This bed also has the capability of a left turn and a right turn assist. It is a 30-degree turn. Amanda's going to activate one of the buttons for you so you can see how the turn occurs. Now, if you're used to our other products, this turn does not occur immediately. It takes a little bit, and there's a side bolster underneath the mattress that will actually lift the mattress to 30 degrees. It's a 30-degree tilt. Once again, it's not designed to push that button and leave the room to say, okay, I've turned my patient to the left side. What you're going to see is the mattress inflate, and that's to help you get that patient turned over, give you the momentum to get them started. Once you place your wedge, your pillows, your positioning device, you're then going to push it back to, the back to static. But we are going to let this mattress inflate first. We're going to let the mattress inflate first so you can see what it looks like in a turn position. Once again, she wants to make sure that all her side rails are engaged by pulling on those side rails to make sure that they are engaged, because as you know, sometimes side rails, you think they're up, but they're really not up. Okay, so now we've got a 30-degree turn. Once again, remember that your patient's going to be immersed and enveloped into that surface. So once that momentum helps me get that patient turned over, then I want to put the mattress back into the static position. So Amanda will push the static button, which is there at the bottom, and static in this case just means flat. Okay? Now you've also got, bed will eventually go back to the flat position. You also have, like we said, a right turn that you can use for a turn assist also. Now in the middle there is a continuous lateral rotation. This is where you're going to be able to adjust the hold times for the surface by pushing the continuous rotation button. And we'll see that they now shows it 3 minutes. That's the 3-minute hold time. That's a pretty aggressive turn that we're typically not going to have on our patient. Typically we're going to do about a 15-minute hold time or 30-minute hold time. And once again, this is a 30-degree turn, so it's not considered a kinetic therapy turn, but it does help with that patient who's unstable to turn, and you want to be able to get some hemodynamic stability and allow them some time to adjust to that physiological turn when you're able to do a manual turn. So to adjust the time, she's just going to push the cycle time at the bottom, and you'll see it go minute to minute up to 20 minutes, and then it'll go to 25, and then once again 30 minutes. To get it out of the continuous rotation, once again you're going to push the static button to put it back static. Now, because this is an air mattress and it's not integrated, it can go on any open architecture frame. If you do need to do CPR, you want to have the patient onto the bed frame or the backboard, and you need to get the air out of the mattress itself. To do CPR, you want to firmly hold the pump with one hand, and then you're going to pull the clips on the side, and the clips will then release the tube set, and then she's going to turn off the air so that you don't have that noise. So she'll turn off the air. Now if she'll hold up those tube sets, you'll see that there are little clips at the side that she released to push on in order to release it from the tube set. Now they are color coded, and on the side of the pump you do have color coding. So once your patient has been resuscitated and you want to get them back onto the surface, you're going to push both tube sets back into the pump, and you're going to turn the air back on. Now you had turned off the off button, so she's going to turn. Typically you don't have to turn off the on-off button. You can just turn the air system back on. The mattress will fill. Use Instaflate once again if you need to. Now there is a long reset. When you do interrupt the power, on the front of the pump you will see a power failure alarm. So when you unplug the bed in order to transfer it, you will lose air. Okay, so keep that in mind. There is a 2-inch layer of foam on the bottom of the bed, but that's not a pressure redistribution foam. So once you get to your location, you want to make sure that you plug that bed back in so that you're going to have power to the surface and get the patient back off of that bed frame. Now this mattress, like I said, is a expandable turning surface. It also has a low air loss feature. So it is an air mattress reactive surface with a low air loss feature. And then Amanda's going to be pointing out that in each of these air cells, you do have holes. That makes it a true air loss, low air loss system, because what's happening is that pump is bringing in, or the blower is bringing in room air. That air is then being pushed through the blower into each of those cells, and it's escaping through those air holes. Okay, this is why it's important that you limit the layers of linen on this product. Really, any product you want to limit your layers because you don't want to really affect the immersion and envelopment, and in this case the airflow, because what happens is those air holes are letting air escape underneath that vortex cover that Amanda's pointing out to you right now, and that air is keeping that patient drier and decreasing their temperature. So remember, less is best, and you don't want to put anything plastic lined. Once your patient is into the mattress, you then need to extend the sides of the frame in order to support the mattress. There are 4 expansions on both sides. The first side to do will be your right side, or the patient's left side. And if you'll notice, Amanda's pointing out the hand where you want to grasp, and the handle extension is there. So you're going to put your palm of your hand up against the frame, put your fingers inside, you're going to pull up on the bar. Now Amanda's showing you the bar. You're going to pull up on that bar by pulling your fingers to your palm of your hand and then pulling it out. There are 4 different expansions. You want to make sure you get all 4. Now the top 2 are attached to the side rail. So a lot of times you have to push in order to pull out that expansion. And then you're going to notice that there's a gap. So Amanda has pulled out and expanded all 4 sides of the right side. She is now going to do the same on the left side in order to get the full 48 inches, so then she can expand the mattress. Keeping in mind once again that the top 2 are attached to the side rail, so you may have to push in order to pull out. This is something that I do recommend you do try to do, because the last thing you want to do is be in an emergency, trying to get maybe the bed collapsed and not be able to get out the door, trying to get to an ICU, and you want to be able to do that motion. Okay, so once you have the bed expanded, you then need to extend and expand the mattress. So right now it's on the 36 inches because that was to get it into the door. She's now going to turn the knob. You can turn it to 42 inches. Like I said, typically if you're going to put a patient in here, you want them to be centered in the bed so you can do the full 48. If you have a very narrow room and your patient does fit on 42, you can leave it just at the 42 expansion, but if you do that, you have to make sure that you're expanding the right side, because you'll notice there's a little hash mark on the 42 inches that, as you're looking at the pump, is on the right side. But like I said, once again, we do recommend you put it at the full 48 inches if your room will accommodate that width. So Amanda's going to turn the knob all the way to 48 inches. And now she can actually even put it on Instaflate if she wants to expand those side bolsters. But once again, those are 6-inch wide bolsters, 10 inches deep. And we're going to then expand and fill up that gap that we had on the mattress. So now you're going to get a 48-inch wide surface. Now you do hear the blowing in the background. That blowing is because we've got the pump on Instaflate and we're filling up those side bolsters rapidly. So you can see that it's expanded. Now, once the bed is expanded, you can still use the turn assist or the continuous rotation as needed to care for your patient. But when the patient is in the surface, you want them immersed and enveloped 2/3 into the surface. You want the surface on static. Now, if you do use continuous rotation, please remember you should not do this continuously. That does not replace your manual turn. The continuous rotation, maybe do it for 1 to 2 hours to get them hemodynamically stable so that you can then do a manual turn. but you want to do your turns Q2 hours as recommended by the National Pressure Injury Advisory Panel. Okay, so now let's say we need to transport that patient. If it's an emergency, what I recommend do in order to deflate that mattress to get out the door, we just pull the CPR. However, we've got time. We're taking the patient down to x-ray. So what Amanda's going to do is she's going to turn the knob on the front of the dial to collapse that mattress back to the 36 inches. So once you have turned the knob on the front of the pump to 36 inches, you then need to collapse the side extensions. So what you're going to do is going to put your palm back up against that decal. You're going to use your fingers and you're going to pull up on that bar and put in all four sides. Now, when you get to the top two, once again, the side rail is on there, so sometimes you have to now pull out in order to push in, and you want to make sure that they're secure, so you want to give them a little push to make sure that they are intact. Once they're intact, and you've given some time for that expansion, that air to get out of that side bolster, then you're able to transport your patient. You're going to take your brakes off, you're going to have both sides collapsed, and then you're going to be able to do your transport. This is the Citadel Plus bed. There is another video that you can watch if you want to see how to operate the buttonology of the Citadel Plus as well as the power drive. Thank you for your attention. Once again, this is the MaxxAir ETS for prevention and treatment of pressure injuries in your patient who needs a wider turning surface up to 1,000 pounds.